this section of the video, we will be talking about the classification of the Nigerian healthcare system in regards to BOMS classification, how the system is funded, regulation of the health system, and how services are delivered. BOMS classification of taxonomy is a way to organize healthcare systems into three dimensions by regulation, financing, and service provision. Each of these three dimensions can be dominated by state, societal, or private actors, which make a total of 27 possible combinations that classify countries. The Nigerian healthcare system fits into the classification of a national health insurance plan, as Nigeria has a national health insurance scheme. This aims to improve access to healthcare and reducing the financial burden of out-of-pocket payment for healthcare services. Social health insurance is a system of financing healthcare through contributions to an insurance fund that operates as a pool of funds to cover the cost of healthcare and eliminates barriers to obtaining service at the time of need, especially for vulnerable groups. Now on to funding. In Nigeria, there is relatively low government spending on health. In 2014, the healthcare expenditure was 3.7% of the country's total GDP. Per capita spending is only $118. The federal, state, and local governments retain overall responsibility for funding health services at their respective level. Approximately 72% of healthcare is provided by private vendors, and only 26% by the government. Over half of the population in Nigeria lives below the poverty line, less than $1 a day. This leaves them unable to afford the high costs of healthcare. Various agencies at the federal and state levels fund programs across different levels through general taxation, direct payment, and donor agencies. Regulation in Nigeria. The national health system is decentralized into a three-tiered structure, with responsibilities at the federal, state, and local government levels. All three tiers are involved in all major health system functions, including stewardship, financing, and service provision. The National Health Act of 2014 aims to establish a framework for regulation, development, and management of the national health system. It sets standards for rendering health services, as well as strives to achieve universal health coverage and meet millennial developmental goals. At a federal level, the Ministry of Health is responsible for policy and technical support to the overall health system, international relations of health matters, the National Health Management Information System, and the provision of health services through tertiary and teaching hospitals and national laboratories. At a state level, the state ministries of health are responsible for secondary hospitals and for the regulation and technical support for primary healthcare services. At a local government level, each local government is subdivided into 7 to 15 different wards, similar to health regions. Primary care is the responsibility of the local governments, where health services are organized through the wards. The community level provides an important link in the healthcare delivery. It forms a support structure for the implementation of primary healthcare services. There are many professional and regulatory bodies in Nigeria, such as the Medical Council of Nigeria, the Nursing and Midwifery Council, Pharmacist Council, Medical Laboratory Scientists, and the Community Health Practitioners Registration Board.
Created using Powtoon.